Ladies and gentlemen, the President of the United States.
Good evening. Please be seated. Before I take your questions, I want to talk for a few minutes about the progress we're making on health insurance reform and where it fits into our broader economic strategy. Now, 6 months ago, I took office amid the worst recession in half a century. We were losing an average of 700,000 jobs per month, and our financial system was on the verge of collapse. As a result of the actions we took in those first weeks, we've been able to pull our economy back from the brink. We took steps to stabilize our financial institutions and our housing market, and we passed a Recovery Act that has already saved jobs and created new ones, delivered billions in tax relief to families and small businesses, and extended unemployment insurance and health insurance to those who've been laid off. Of course, we still have a long way to go, and the Recovery Act will continue to save and create more jobs over the next 2 years, just like it was designed to do. I realize this is a little comfort to those Americans who are currently out of work, and I'll be honest with you. New hiring is always one of the last things to bounce back after a recession. And the fact is, even before this crisis hit, we had an economy that was creating a good deal of wealth for those folks at the very top, but not a lot of good-paying jobs for the rest of America. It's an economy that simply wasn't ready to compete in the 21st century, one where we've been slow to invest in clean energy technologies that have created new jobs and industries in other countries, where we've watched our graduation rates lag behind too much of the world, and where we
Ladies and gentlemen, the President of the United States.
Good evening. Please be seated. Before I take your questions, I want to talk for a few minutes about the progress we're making on health insurance reform and where it fits into our broader economic strategy. Now, 6 months ago, I took office amid the worst recession in half a century. We were losing an average of 700,000 jobs per month, and our financial system was on the verge of collapse. As a result of the actions we took in those first weeks, we've been able to pull our economy back from the brink. We took steps to stabilize our financial institutions and our housing market, and we passed a Recovery Act that has already saved jobs and created new ones, delivered billions in tax relief to families and small businesses, and extended unemployment insurance and health insurance to those who've been laid off. Of course, we still have a long way to go, and the Recovery Act will continue to save and create more jobs over the next 2 years, just like it was designed to do. I realize this is a little comfort to those Americans who are currently out of work, and I'll be honest with you. New hiring is always one of the last things to bounce back after a recession. And the fact is, even before this crisis hit, we had an economy that was creating a good deal of wealth for those folks at the very top, but not a lot of good-paying jobs for the rest of America. It's an economy that simply wasn't ready to compete in the 21st century, one where we've been slow to invest in clean energy technologies that have created new jobs and industries in other countries, where we've watched our graduation rates lag behind too much of the world, and where we spend much more on health care than any other nation, but aren't any healthier for it. And that's why I've said that even as we rescue this economy from a full-blown crisis, we must rebuild it stronger than before. And health insurance reform is central to that effort. This is not just about the 47 million Americans who don't have any health insurance at all. Reform's about every American who has ever feared that they may lose their coverage if they become too sick, or lose their job, or change their job. It's about every small business that has been forced to lay off employees or cut back on their coverage because it became too expensive. And it's about the fact that the biggest driving force behind our federal deficit is the skyrocketing cost of Medicare and Medicaid. So let me be clear. If we do not control these costs, we will not be able to control our deficit. If we do not reform health care, your premiums and out-of-pocket costs will continue to skyrocket. If we don't act, 14,000 Americans will continue to lose their health insurance every single day. These are the consequences of inaction. These are the stakes of the debate that we're having right now. I realize that with all the charges and criticisms that are being thrown around in Washington, a lot of Americans may be wondering, what's in this for me? How does my family stand to benefit from health insurance reform? So tonight I want to answer those questions, because even though Congress is still working through a few key issues, we already have rough agreement on the following areas. If you have health insurance, the reform we're proposing will provide you with more security and more stability. It will keep government out of health care decisions, giving you the option to keep your insurance if you're happy with it. It will prevent insurance companies from dropping your coverage if you get too sick. It will give you the security of knowing that if you lose your job, if you move, or if you change your job, you'll still be able to have coverage. It will limit the amount your insurance company can force you to pay for your medical costs out of your own pocket. And it will cover preventive care like checkups and mammograms that save lives and money. Now, if you don't have health insurance, or you're a small business looking to cover your employees, you'll be able to choose a quality, affordable health plan through a health insurance exchange, a marketplace that promotes choice and competition. And finally, no insurance company will be allowed to deny you coverage because of a pre-existing medical condition. I've also pledged that health insurance reform will not add to our deficit over the next decade, and I mean it. In the past 8 years, we saw the enactment of 2 tax cuts, primarily for the wealthiest Americans, and a Medicare prescription program, none of which were paid for. And that's partly why I inherited a $1.3 trillion deficit. That will not happen with health insurance reform. It will be paid for. Already we've estimated that 2/3 of the cost of reform can be paid for by reallocating money that is simply being wasted in federal health care programs. This includes over $100 billion of unwarranted subsidies that go to insurance companies as part of Medicare, subsidies that do nothing to improve care for our seniors. And I'm pleased that Congress has already embraced these proposals. While they're currently working through proposals to finance the remaining costs, I continue to insist that health reform not be paid for on the backs of middle-class families. In addition to making sure that this plan doesn't add to the deficit in the short term, the bill I sign must also slow the growth of health care costs in the long run. Our proposals would change incentives so that doctors and nurses are free to give patients the best care, just not the most expensive care. That's why the nation's largest organizations representing doctors and nurses have embraced our plan. We also want to create an independent group of doctors and medical experts who are empowered to eliminate waste and inefficiency in Medicare on an annual basis, a proposal that could save even more money and ensure long-term financial health for Medicare. Overall, our proposals will improve the quality of care for our seniors and save them thousands of dollars on prescription drugs, which is why the AARP has endorsed our reform efforts. Not all of the cost savings measures I just mentioned were contained in Congress's draft legislation, but we're now seeing broad agreement thanks to the work that has been done over the last few days. So even though we still have a few issues to work out, what's remarkable at this point is not how far we have left to go, it's how far we've already come. I understand how easy it is for this town to become consumed in the game of politics, to turn every issue into a running tally of who's up and who's down. I've heard that one Republican strategist told his party that even though they may want to compromise, it's better politics to go for the kill. Another Republican senator that defeating health care reform is about breaking me. So let me be clear. This isn't about me. I have great health insurance, and so does every member of Congress. This debate is about the letters I read when I sit in the Oval Office every day and the stories I hear at town hall meetings. This is about the woman in Colorado who paid $700 a month to her insurance company only to find out that they wouldn't pay a dime for her cancer treatment, who had to use up her retirement funds to save her own life. This is about the middle-class college graduate from Maryland whose health insurance expired when he changed jobs and woke up from the emergency surgery that he required with $10,000 worth of debt. This is about every family, every business, and every taxpayer who continues to shoulder the burden of a problem that Washington has failed to solve for decades. This debate is not a game for these Americans, and they can't afford to wait any longer for reform. They're counting on us to get this done. They're looking to us for leadership, and we can't let them down. We will pass reform that lowers cost, promotes choice, and provides coverage that every American can count on, and we will do it this year. With that, I'll take your questions, and we are going to start off with Ben Feller at Associated Press.
Thank you, Mr. President. Congress, as you alluded to, is trying to figure out how to pay for all of this reform. Have you told House and Senate leaders which of their ideas are acceptable to you? If so, are you willing to share that stand of yours with the American people? And if you haven't given that kind of direction to congressional leaders, are you willing to explain why you're not stepping in to get a deal done since you're the one setting a deadline?
Well, before we talk about how to pay for it, let's talk about what exactly needs to be done. And the reason I want to emphasize this is because there's been a lot of misinformation out there. Right now, premiums for families that have health insurance have doubled over the last 10 years. They've gone up 3 times faster than wages. So what we know is that if the current trends continue, more and more families are going to lose health care. More and more families are going to be in a position where they keep their health care, but it takes a bigger bite out of their budget. Employers are going to put more and more of the costs on the employees, or they're just going to stop providing health care altogether. We also know that with health care inflation on the curve that it's on, we are guaranteed to see Medicare and Medicaid basically break the federal budget. And we know that we're spending, on average, we here in the United States are spending about $6,000 more than other advanced countries where they're just as healthy. And I've said this before, if you found out that your neighbor had gotten the same car for $6,000 less, you'd want to figure out how to get that deal. And that's what reform's all about. How can we make sure that we are getting the best bang for our health care dollar? Now, what we did very early on was say 2/3 of the costs of health care reform, which includes providing coverage for people who don't have it, making it more affordable for folks who do, and making sure that we're, over the long term, creating the kinds of systems where prevention and wellness and information technologies make the system more efficient, that the entire cost of that has to be paid for and it's got to be deficit neutral. And we identified 2/3 of those costs to be paid for by tax dollars that are already being spent right now. So taxpayers are already putting this money into the kitty. The problem is they're not getting a good deal for the money they're spending. That takes care of about 2/3 of the costs. The remaining one-third is what the argument has been about of late. What I've said is that there may be a number of different ways to raise money. I put forward what I thought was the best proposal, which was to limit the deductions, the itemized deductions, for the wealthiest Americans. People like myself could take the same percentage deduction that middle-class families do, and that would raise sufficient funds for that final one-third. Now, so far, we haven't seen any of the bills adopt that. There are other ideas that are out there. I continue to think my idea is the best one, but I'm not foreclosing some of these other ideas as the committees are working them through. The one commitment that I've been clear about is I don't want that final one-third of the cost of health care to be completely shouldered on the backs of middle-class families who are already struggling in a difficult economy. And so if I see a proposal that is primarily funded through taxing middle-class families, I'm going to be opposed to that because I think there are better ideas to do it. Now, there are, I have not yet seen what the Senate Finance Committee is producing. They've got a number of ideas, but we haven't seen a final draft. The House suggested a surcharge on wealthy Americans, and my understanding, although I haven't seen the final versions, is that there's been talk about making that basically only apply to families whose joint income is $1 million. To me, that meets my principle that it's not being shouldered by families who are already having a tough time. But what I want to do is to see what emerges from these committees, continuing to work to find more savings, because I actually think that it's possible for us to fund even more of this process through identifying waste in the system, try to narrow as much as possible the new revenue that's needed on the front end, and then see how we can piece this thing together in a way that's acceptable to both Democrats and I hope some Republicans.
Your job to get a deal done?
Absolutely, it's my job. I'm the president, and I think this has to get done. Just a broader point. If somebody told you that there is a plan out there that is guaranteed to double your health care costs over the next 10 years, that's guaranteed to result in more Americans losing their health care, and that is by far the biggest contributor to our federal deficit, I think most people would be opposed to that. Well, that's the status quo. That's what we have right now. So if we don't change, we can't expect a different result. And that's why I think this is so important, not only for those families out there who are struggling and who need some protection from abuses in the insurance industry or need some protection from skyrocketing costs, but it's also important for our economy. And by the way, it's important for families' wages and incomes. One of the things that doesn't get talked about is the fact that when premiums are going up and the costs to employers are going up, that's money that could be going into people's wages and incomes. And over the last decade, we basically saw middle-class families, their incomes and wages flatlined. Part of the reason is because healthcare costs are gobbling that up. And that's why I say if we can, even if we don't reduce our healthcare costs by the $6,000 that we're paying more than any other country on earth, if we just reduced it by $2,000 or $3,000, that would mean money in people's pockets. And that's possible to do, but we're going to have to make some changes. We've got to change how healthcare is delivered to the healthcare delivery system works so that doctors are being paid for the quality of care and not the quantity of care. We've got to make information technology more effective. We've got to have the medical system work in teams so that people don't go through 5 different tests. Those are all critical to do, and we can do them. Now, I understand that people are feeling uncertain about this. They feel anxious, partly because we've just become so cynical about what government can accomplish that people's attitudes are, even though I don't like this devil, at least I know it, and I like that more than the devil I don't know. So folks are skeptical, and that is entirely legitimate because they haven't seen a lot of laws coming out of Washington lately that help them. But my hope is, and I'm confident that when people look at the costs of doing nothing, they're going to say, we can make this happen. We've made big changes before that end up resulting in a better life for the American people. So, David Alexander, Reuters.
Thank you, Mr. President. You've been pushing Congress to pass health care reform by August. Why the rush? Are you worried that if you don't, there's a delay until the fall, the whole effort will collapse?
Couple of points. Number one, I'm rushed because I get letters every day from families that are being clobbered by health care costs. And they ask me, can you help? So I've got a middle-aged couple that will write me and they say, our daughter just found out she's got leukemia, and if I don't do something soon, we just either are going to go bankrupt or we're not going to be able to provide our daughter with the care that she needs. And in a country like ours, that's not right. So that's part of my rush. The second thing is the fact that if you don't set deadlines in this town, things don't happen. The default position is inertia, because doing something always creates some people who are unhappy. There's always going to be some interest out there that decides, you know what, the status quo is working for me a little bit better. And the fact that we have made so much progress, where we've got doctors, nurses, hospitals, even the pharmaceutical industry, AARP, saying that this makes sense to do, I think means that the stars are aligned and we need to take advantage of that. Now, I do think it's important to get this right. And if, at the end of the day, I do not yet see that we have it right, then I'm not going to sign a bill that, for example, adds to our deficit. I won't sign a bill that doesn't reduce health care inflation so that families as well as government are saving money. I'm not going to sign a bill that I don't think will work. And my measure of whether things work or not are listening to the American people, but also listening to healthcare experts who have shown that in some communities, healthcare is cheaper and delivers a better result. I think we can achieve that. So I'm confident that if we just keep at it, we keep working, we're diligent, we're honest, if we take criticisms that are out there and modify whatever plans are already working through Congress so that it meets those concerns and those criticisms, that we can arrive at a bill that is going to improve the lives of the American people. And I'll give you one specific example. I think that there was legitimate concern that we had not incorporated all of the measures that could reduce health care inflation over the long term in some of the versions of health care reform that were coming out of the committee. Well, over the last week, working with not only health care experts, but also members of Congress who are concerned about this, we actually have now gotten a commitment to incorporate an idea that has a panel of doctors and health care experts advising on how we can get a better value for our money in Medicare. And every expert out there says this can be a valuable tool to start reducing inflation over the long term. So, can I say this though? If we hadn't had any kind of deadline, that change probably would have never surfaced until who knows when. And so, you know, I want to do this right, but the American people need some relief. Chuck Todd.
Thank you, sir. We're just talking in that question about reducing the healthcare inflation, reducing costs. Can you explain how you're going to expand coverage? Is it fair to say, is this bill going to cover all 47 million Americans that are uninsured Or is this going to be something, is it going to take a mandate? Or is this something that isn't, your bill is probably not going to get it all the way there? And if it's not going to get all the way there, can you say how far is enough? You know, okay, 20 million more, I can sign that. 10 million more, I can't.
I want to cover everybody. Now, the truth is that unless you have what's called a single payer system in which everybody's automatically covered, then you're probably not going to reach every single individual, because there's always going to be somebody out there who thinks they're indestructible and doesn't want to get health care, doesn't bother getting health care, and then unfortunately when they get hit by a bus, end up in the emergency room and the rest of us have to pay for it. But that's not the overwhelming majority of Americans. The overwhelming majority of Americans want health care, but millions of them can't afford it. So the plan that I've put forward, and that what we're seeing in Congress, would cover, the estimates are at least 97 to 98% of Americans. There might still be people left out there who, even though there's an individual mandate, even though they are required to purchase health insurance, might still not get it, or despite a lot of subsidies, are still in such dire straits that it's still hard for them to afford it, and we may end up giving them some sort of hardship exemption. But, I'm sorry, go ahead, Chuck. So I think that the basic idea should be that in this country, if you want health care, you should be able to get affordable health care. And given the waste that's already in the system right now, if we just redesign certain elements of health care, then we can pay for that. We can pay for it in the short term, but we can also pay for it in the long term. And in fact, there's going to be a whole lot of savings that we obtain from that because, for example, the average American family is paying thousands of dollars in hidden costs in their insurance premiums to pay for what's called uncompensated care. People who show up at the emergency room because they don't have a primary care physician. If we can get those people insured, and instead of having a foot amputation because of advanced diabetes, they're getting a nutritionist who's working with them to make sure that they are keeping their diet where it needs to be. That's going to save us all money in the long term.
Back to the politics of it. You mentioned 2 Republicans in your opening statement, but you have 60 Democratic seats, a healthy majority in the House.
Right.
If you don't get this, isn't this a fight inside the Democratic Party, and that Republicans really aren't playing? You can't really blame the Republicans for this one?
Well, first of all, you haven't seen me out there blaming the Republicans. I've been a little frustrated by some of the misinformation that's been coming out of the Republicans, but that has to do with, as you pointed out, politics. You know, if you've got somebody out there saying, not that, you know, let's get the best bill possible, but instead says, you know, let's try to beat this so we can gain political advantage, well, you know, that's not, I think, what the American people expect. I am very appreciative that people like Chuck Grassley on the Finance Committee in the Senate, people like Mike Enzi, people like Olympia Snowe, have been serious in engaging Democrats in trying to figure out how do we actually get a system that works. And even in those committees where you didn't see Republican votes, we've seen Republican ideas. So, for example, in the Health Committee in the Senate, 160 Republican amendments were adopted into that bill because they've got good ideas to contribute. So the politics may dictate that they don't vote for health care reform because they think, you know, it'll make Obama more vulnerable. But if they've got a good idea, we'll still take it. And in terms of Democrats, the fact of the matter is that because this is a big issue, I think that a lot of Democrats have a lot of different ideas. Some of them have to do with regional disparities. For example, you've got some Democrats who are concerned that the Medicare reimbursement rates in their communities are too low, and so they'd like to see the bill incorporate higher rates for doctors and providers in rural communities to incentivize